Hi, this is George with 573 Medicine, and in this video we're going to be discussing bone and cartilage. So let's get started. Cartilage is a type of connective tissue which is composed largely of collagen. And there are different types of cartilage, and here are the locations of these cartilages in adults. The first is hyaline cartilage, which we find at the costochondral junction, as well as joints and in the nose. So it's going to be this cyan color right here. The next is elastic cartilage. Elastic cartilage is going to be purple, and that's going to be the cartilage of the external ear. And the last is fibrocartilage, and we're going to find these in between the vertebrae of the spine, as well as in the meniscus. And in this video, we're primarily going to be focusing on hyaline cartilage. This is a close-up picture of cartilage. So we can see the perichondrium. So peri meaning around, and chondro meaning cartilage. So the perichondrium is going to be lining the cartilage, and this is going to be composed of mesenchymal stem cells, which will later develop into osteoblasts and osteoclasts. We have chondrocytes, which are the cells of the cartilage, which are surrounded in these lacunae, and lacunae are going to be just artifacts that don't stain well on H&E. They're not actually part of the structure, but this is a great picture to help you visualize what cartilage looks like. So there are two processes you should be aware of. The first is endochondral ossification, and this is the process where hyaline cartilage is converted into bone. And this occurs from the first trimester to the teenage years / early adulthood, and this occurs primarily in long bones. So think bones like the femur and the radius are going to be long and skinny bones, and this is where the cartilage is converted into bone. The next is intramembranous ossification or dermal ossification, and this is going to occur in non-long bones, so bones that aren't long and skinny like the skull. And this is the conversion of fibroelastic membrane into bone. These are the steps of endochondral ossification. Don't get too caught up in the details of endochondral ossification, but it's here for your reference in case you were wanting to look at this and study this later. This is a picture of a mature long bone. We have the diaphysis, the proximal epiphysis, and the distal epiphysis. And we also have this area called the metaphysis. The metaphysis in this picture is composed entirely of bone, but when a bone is being created from hyaline cartilage in the developing fetus, we get what are called the epiphyseal plates in the area of the metaphyses, and these are going to be our growth plates. And these growth plates are going to continue to do endochondral ossification to allow these long and skinny bones to grow taller and for you to grow taller as you age. Next, let's talk about compact bone. So the cortical lining, or the outer lining of bone, is cortical or compact bone, and the functional unit of compact bone is the osteon. The medullary cavity is lined with spongy bone, and this is more porous and trabeculated, and the functional unit is the trabeculae. So here is the osteon, which is the functional unit of compact bone, which lines the cortex. And here is the trabeculae of spongy bone, which lines the medullary cavity. We can pay attention to the blood supply of these areas. So longitudinally, we have the Haversian canal, as well as Volkmann canal, and this is going to be transverse. And so we rely on the Haversian canal in order to supply blood to the bone. And bone is notoriously challenging to bone is notoriously an area which is susceptible to ischemia, as well as infections such as osteomyelitis, and it's incredibly difficult to treat these infections because of the way that blood travels through the bone in this particular manner. So that's why oftentimes people who get infections or ischemia of the bone have to do amputations instead of being able to be treated with medications. Something else to note is that we have the periosteum. So it's not the perichondrium anymore, it's the periosteum. because this is the lining of bone and not cartilage. This is a close-up of compact bone. We have the osteon with the Haversian canal, which contains blood vessels and nerves centrally. We have these darker staining areas called osteocytes, and we have these finger-like projections called canaliculi. So next, let's talk about cells that are found in the bone. We have osteoblasts, which we can see here, and these resemble epithelium and build bone. So remember, osteoblasts build, so the blast build. We have osteoclasts, which are incredibly large cells, and these have many nuclei, and these are responsible for the resorption of bone. And so you can remember clast tissue, so clast kind of destroy or resorb bone to remodel bone to make sure that there is a robust extracellular matrix. And we have this area called Hauschipp lacunae. So this is actually the area of bone which was sort of resorbed by these osteoclasts. And we also have these osteocytes, and these are osteoblasts, which are trapped in the bony matrix that they created. So that's it for this video. If you liked the video, please like, comment, and subscribe, and feel free to email us anytime at realtalkmeded@gmail.com for any comments, questions, or concerns.